We all want to maintain our mental sharpness as we get older. Dementia, Alzheimer's disease, and cognitive decline are conditions everyone hopes to avoid. Did you know research has shown that untreated hearing loss plays a role in our ability to stay mentally sharp as we age? While researchers admit they don't know exactly how untreated hearing loss increases dementia and Alzheimer's risks, they do offer 3 probable reasons. Number 1, untreated hearing loss has long been linked to social isolation and loneliness, which studies have shown increases the risk of Alzheimer's and dementia. Think about it. If you struggle to hear, you'll be more likely to withdraw from social activities or situations where hearing plays a key role. Number 2, as hearing becomes more difficult, your brain has to work harder to register and comprehend what you're listening to. This steals energy needed for memory and thinking. Imagine your brain as having a finite amount of fuel. The more fuel you use for listening and comprehension, the less fuel you'll have for memory and other routine tasks. And finally, hearing loss is shown to accelerate brain atrophy or shrinkage. Yes, believe it or not, our brains shrink as we age. But researchers at Johns Hopkins found that people with impaired hearing lost more brain tissue per year than peers with normal hearing, likely due to atrophy from lack of stimulation. Now, this data is not meant to scare you, but rather inform you about the correlation between untreated hearing loss and cognition. Recently, however, there's been good news. A study by the Lancet Commission on Dementia Prevention, Intervention, and Care concluded that managing or treating hearing loss in midlife is the single largest risk factor that you can modify for the prevention of dementia. And a 2023 study showed that for people with hearing loss who are already at increased risk for cognitive decline, using hearing aids lowered their risk for dementia by nearly half. Listen, there are hundreds of reasons why treating hearing loss is good for your quality of life. The research linking hearing loss to cognitive issues is just one more incentive to treat hearing loss as soon as possible. If you're ready to be proactive about your hearing and your cognitive health, a visit with a hearing care professional is a smart first step. They can accurately test your hearing and consult with you on the best treatment options. Not sure where to find a hearing care professional? We can help. Just go to the website on the screen, type in your zip code, and you'll generate a list of local providers you can call.